Dear colleagues, thank you for joining us for the 13th Diabetes and Ramadan International Alliance Annual Conference. I'm delighted to be joining you, and I'd like to take the opportunity to thank the organizers for their kind invitation and to give us the opportunity to present our study that looked at the impact of fasting on stroke admissions during Ramadan. I have no relevant disclosures for this presentation. Now, when we look at the outcomes of fasting during Ramadan in individuals with diabetes, it's a bit like this glass. We can think of it as either half empty or half full. I'm an optimist, and therefore I usually try to think of it as half full. And the reason why the outcomes are maybe so varied is because the risk for fasting is different between different individuals. Now, why are we concentrating a lot on diabetes? What is the peculiarity about Ramadan and diabetes? We know there are over 2 billion Muslims in the world. We make up 25% of the world's population. Approximately 100 Muslims are living with diabetes, and 90% of them have type 2 diabetes. And if we look at the epidemiological data on persons with diabetes and the fasting patterns during Ramadan, we can see that a large majority of them will be able to fast more than 15 days, and over half are able to fast all the 30 days. Now, the risk of fasting in people with diabetes are mainly the hypo and hyperglycemia, development of glycemic crisis such as diabetic ketoacidosis, dehydration, and thrombosis, particularly when there is, because of hemoconcentration, fibrinolysis, or an increase in the clotting factors. So when we're considering this risk, there are Ramadan-related factors, diabetes-related factors, and factors that are peculiar to the individual who is fasting. So let's first look at Ramadan-related factors, and these could be the length of the fasting hours, the season of fasting, how hot or warm it is. So it would vary from the geographical locations. And then if we look at diabetes-related factors, we look at the type of diabetes the individual has, type 1 or type 2, the duration of the disease, the presence of complications, what therapies they're on, the sort of control that they have, the risk for hypoglycemia, and the access to care. And then factors related to the individual, the age, but more importantly, the frailty, occupation, particularly in those individuals who engage in physical labor for a large part of the day. And then exercise and other personal preferences would also come into play. But taking those factors into consideration, we're then able to use the IDF risk calculator and stratify the patients into either low, moderate, or high risk. And depending on the risk, the physician is then able to inform the patient whether they can fast safely, so that if they're in the low risk, whether they're in moderate risk, and therefore that has to be done cautiously. And if they're in the high risk, we advise against fasting. So the question is, what is the impact of Ramadan fasting on stroke admissions? So what I'm going to do is discuss some of the potential benefits of fasting and how these could reduce the stroke risk. I'm also going to address risks such as dehydration and glucose fluctuations that might potentially increase the risk for strokes in vulnerable populations. And I will review the epidemiological data on stroke admissions during Ramadan fasting and highlight the preliminary results from our study as well. So we know that ischemic stroke is one of the most prevalent causes of hospitalization and mortality in the Western world. The risk factors include both medical conditions, hypertension being one of them, diabetes, dyslipidemia, atrial fibrillation, and then lifestyle factors such as smoking and physical inactivity. Ramadan comes with some peculiarities. There's associated changes such as sometimes poor drug compliance. There may be a reduction in the glycemic control if the patient is not adequately managed. Dehydration may also be a problem, and these factors may temporarily contribute to the risk for development of strokes. In the diabetes and Ramadan study of 2020, we saw that the reported complications among individuals with type 2 diabetes above the age of 65, as shown here, there was a high risk for hypertension and dyslipidemia, but what I would also highlight is that they also had a higher risk for coronary heart disease, strokes, and peripheral vascular disease. So let me just go and show you the summary from the literature of stroke studies in Ramadan over the last 2 decades. There are many retrospective reviews in large databases, ranging from around 200 patients to over 4,000 in different geographical areas, some within the Gulf countries, in Egypt, in Turkey, and in Saudi Arabia as well, and in southern Israel. The first studies that I've highlighted in the blue showed no significant differences in hospitalizations for stroke during Ramadan when we compared those individuals who were fasting versus the individuals that were not fasting. However, in 2018, there was this one study. It was a retrospective cohort that showed that Ramadan, particularly in the first 2 weeks, was an independent and ethnic-specific risk factor for ischemic stroke hospitalization among Bedouin Arabs that were studied in that study. So it was published in the Journal of the American Heart Association in 2018, and the authors put up this as sort of clinical perspective, and they said that observant Muslims are at an increased risk to develop stroke during Ramadan, and further research is warranted. So that brings me to our study. So we wanted to look at the impact of Ramadan fasting on acute stroke admissions in the 2 main tertiary hospitals of Dubai Health. It was prospectively, so we'll be looking at, in the months before Ramadan, during Ramadan, and after Ramadan. And we included all patients that were admitted with a diagnosis of stroke based on their NIH scores to the acute medical and neurology units. And we collected data on baseline demographics such as age, the gender, the BMI, smoking status. We looked at risk factors, the presence of diabetes, hypertension, dyslipidemia, and others, the number of days that the patients were fasting, and the type of medications that they were on. So this is a list of all the study variables. We also looked at the stroke severity, the number of days that they were in hospital, or mortality that was related to the stroke, and the disability index at discharge. So here is a snapshot of the stroke admissions for the 2 hospitals in 2024. In blue are the patients that came in with intracerebral hemorrhages, and in the orange bars are the patients that came in with ischemic strokes. And what I would like to highlight is the fact that during the month before Ramadan, so in Sha'ban, during Ramadan and Shawwal, we can see that the number of stroke admissions was relatively constant. It was relatively the same, thereby showing that there is no increased risk of developing strokes when an individual is fasting. And this is a summary of the patients just for the 1 hospital. So their mean age was about 57, BMI was 27. Blood pressures on admission were relatively well controlled at 140 by 82 millimeters of mercury. The mean hemoglobin A1C we found was 7.3 with an EGFR of 92 and an LDL of 113. So when we look at the age distribution, we find that 78% were large, majority of them were less than 65 years of age. And then if we look at the fasting status, these were the 80 patients that we had in one of the tertiary hospitals. 2 of the patients were able to fast the whole month before they were admitted with a stroke, whereas 7 of the patients had fasted for more than 15 days. This was the diabetes status. 56% of them had diabetes, and the other 44% did not have diabetes. And then we were able to look at what was their IDF DAR risk category. It turned out that 67% of them were in the low category, so they could fast, they had a very low risk. 22% of them were in the high risk, and 11% were in the medium risk. So to summarize then, we know that Ramadan fasting affects multiple aspects of lifestyle. Fluid and dietary intake is interrupted. Sleep patterns change dramatically. Physical activity also changes, as well as sometimes compliance to medical therapy. And we know that such alterations may have a potential to induce cardiovascular events. However, several studies that have assessed the incidence of various cardiovascular outcomes have failed to demonstrate an increased risk during Ramadan. Similarly, previous studies have failed to demonstrate an increased stroke risk during Ramadan, comparing the stroke admissions during Ramadan and to the months prior to Ramadan and after Ramadan. Only one study, as I highlighted earlier, found an increased risk of stroke admissions among a particular population during Ramadan. The preliminary data from our study shows that there was no adverse impact of Ramadan fasting on stroke admissions. I'd like to acknowledge members of the diabetes unit at Rashid Hospital, the Salama research team, and the ethics committee at the MBRU. With that, I'd like to thank you for your attention, and I look forward to taking your questions. Thank you.